Okay, let's get started. Welcome to Penn State CTSI BERD seminar series. My name is Lan Kong. I'm one of the three co-hosts for this seminar series, along with my colleagues Dr. Murphy and Dr. Zhu. So as you know, we already have several excellent presentations this fall. And we are going to conclude our seminar series today with very important topics on diversity and inclusion consideration in clinical trials. So if you are interested in watching the past seminars, you can go to this link on the CTSI website to find out the recordings. As a reminder, our seminar is recorded. Attendees, please mute yourself when our speaker is giving the lecture, but please turn on the camera because this is going to be a very engaging seminar today. You can submit the questions using the chat box during the lecture. There will be a Q&A session at the end. The slides and the recording link will be sent out to you after seminar. And we would like to hear your feedback about our seminar. So please complete the survey once you receive it. So now it's my great pleasure to introduce three speakers for today's talk. Dr. Inginia Genao is the inaugural Vice Dean of Diversity, Equity, and Belonging at Penn State College of Medicine. Prior to joining Penn State, she was a faculty member at Yale School of Medicine for 16 years, first serving in the role of medical director of the Adult Primary Care Center, and later serving as associate chair for diversity and inclusion in the Department of Medicine, and as director of diversity, equity, and inclusion for graduate medical education. Before her appointment at Yale, Dr. Genao was assistant professor at Emory University, where she founded the Department of Multicultural Affairs and the International Medical Center at Grady Memorial Hospital. Dr. Genao is the recipient of various awards, including Yale's Faculty Award for Achievement in Clinical Care, the Community Leadership Award for the Georgia Hospital Association, the National Association of Public Hospitals Safety Net Award, and the Health Leadership Award from the National Hispanic Medical Association. Most recently, she received the American College of Physicians Connecticut Chapter Award, the Herbert W. Nickens Minority and Representation in Medicine Award from the Society of General Internal Medicine, and the Yale Minority Organization for Retention and Expansion Award, all in recognition of her extraordinary work in diversity, equity, and inclusion. So our second speaker, Dr. Wang, is associate professor from Penn State College of Medicine. She conducts research in the area of health policy, health economics, and health service research. She served as the director of the Master of Science in Clinical Research Program. As the DEIB champion at Department of Public Health, she works with DEIB office at the College of Medicine to promote DEIB efforts and initiatives. Our third speaker, Ms. Victoria Francois, is actually our DRPH candidate at the Department of Public Health Sciences. She is very interested in health disparity research, particularly on Black women's health outcomes and quality of life. She has worked with DEIB office at College of Medicine as a graduate research assistant and DEI advocate. So now, without further ado, I would like to hand it over to our presenters who will walk us through how to enhance diversity and inclusion in clinical trials.
Thank you. I'm going to get started, and thank you so much for having us. And it is a pleasure to be here. I would like to please encourage all of you to turn on your cameras because we really want for this to be engaging. And we also want to see your faces. Let's see. Okay, okay, there is one. Okay, excellent. So thank you. So let me share my screen and we will get started. I'm assuming that can be seen. Okay. I also want to, before I get started, I also want to thank Pamela Witt, who joined us. She's the one to take credit for all the beautification of these slides. So she's a director of operations in my office, and she does an amazing job. So as you may realize, enhancing diversity and inclusion in clinical trials is not something that we can accomplish in an hour or less than an hour now. So what we would like to do today is to focus on why in 2024, this is still a problem. And then explore with you some of the strategies, both at the institutional level and at the local levels. So I'm going to have Victoria lead us with a discussion, and then Lee is going to address the institutional strategies. I am going to follow up with the research team strategies to enhance diversity and inclusion in your trials. And then we're going to open it up to a Q&A. So I'm going to pass it on to Victoria to lead us into the discussion.
Yep, thank you, Dr. Genao. So first, let's get familiar with clinical trial diversity in the United States. One study found that over 860,000 participants across 740 trials found that only 38.2% of those participants identified as women. In another review of 370 NIH-funded clinical trials, that review found that only 48% of the studies provided complete participant racial ethnic information. And then in one other study that we looked at, it found that despite the increase in racial ethnic diversity in the United States, we still find that 75% of participants who are enrolled in clinical trials, at least in the year 2020, identified as white. So we still have a lot of work to do in this domain. Dr. Genao, you can go to the next slide. So I would like, with all of these studies in mind, I'd like to hear from you all. Why is there a lack of diversity and inclusion of historically underrepresented groups in clinical trials? I have a poll for us first so that we can kind of gather some of our thoughts, and then I'd like for us to be able to expand on some of our responses. So I'm going to launch the poll here on Zoom. And I'll give us about a minute or so to think about this question. Again, the question is, why is there a lack of diversity and inclusion of historically underrepresented groups in clinical trials? And you can give one answer, two answers, but I'll give you a minute for that.
Hi, Victoria. I'm not being able to answer for some reason the poll. Like I see the poll question and I click on the question, but after that, I'm not able to answer.
Oh no. Well, it looks like we have 6 responses. So if you have a response, then I would love to hear from you.
I think it's because you are one of the co-hosts, so we are not
That might be it.
given
Oh,
the
okay.
opportunity.
Okay.
Yeah.
The
Thanks.
co-host can contribute to the discussion once the poll is done.
All right, let's give about 10 more seconds for anyone else who would like to respond. Okay, thank you all so much for responding. So let's take a look at some of these results here. Are you all able to see the responses? I don't think I can see the response.
Yeah, I think I need to stop sharing.
Let's see. For some reason, I'm not able to see the responses, but from those who did respond, would anyone like to elaborate on what they said? No, you can't see the responses either. That's all right.
No, for some reason, it's not.
What about now? I just reshared. No, you still can't see it. That's all right. Oh, and in the chat, Dr. Genao, it says that they're not able to see the slides. Do you think you could reshare them again?
Yes, I will do so.
Thank you. So while Dr. Genao's resharing the slides, let's hear from maybe 2 or 3 people. Why is there a lack of diversity and inclusion of historically underrepresented groups in clinical trials? What were some things you came up with?
Hello.
Hi.
I said that some of the researchers in the past have abused minority groups by signing them up and putting them in research trials without telling them they were even in a research trial. So that has broken some of the trust in the community with whether research trials are ethical and whether they're going to get abused when they go into it.
Yeah, absolutely. So I heard mistrust from community and also a lack of transparency from the study research team for sure. What are some others? Maybe I'd like to hear from 1 or 2 more.
I said that the trials are based in academic medical centers rather than in communities. So it's a lack of access to trials.
Yep, perfect. And then I'd like to hear from 1 more. Yep, go ahead, Terrence.
Yeah, what Tulika just said, I was going to say that same thing, that it seems like universities have these research centers established and they have kind of things set up that they've been operating a long time, but they tend to not get a broad swath of the population. They tend to get this same kind of narrow, more middle class people with higher education. I know in many trials, there's this bias. You get kind of better, healthier results in the trial than in the regular population for the same reason.
Right, so a lack of community outreach. Perfect. Thank you so much, Dr. Genao. We can go to the next slide.
Will do. 1 second.
Awesome. So a lot of these reasons we briefly touched on before, and Dr. Genao will elaborate a little bit in the next slide. But there's a cost to participants when we have clinical trials. There's a lack of study team trainings on recruitment of diverse populations. There's also bias and stereotyping from study team personnel. There might not be as many institutional policies to promote diversity and inclusion in clinical trials. When we also look at the study design, there might be some restrictive eligibility criteria that would kind of reduce the amount of diversity that we might see within our study participants. We talked about community outreach, and we also talked about mistrust. And there might be a lack of awareness of clinical trial opportunities from the perspective of a participant. So I'll pass it over to Dr. Genao to talk a little bit more about some of these.
Thank you, Victoria. So what I would like to do now is to go more in depth in some of those reasons. And I want to focus on 2 areas that addresses the research team level and the institutional level. So let's start with the lack of DEIB in the research team, because that can be one of the reasons for not having diversity in your trials. So when we think about diversity, excuse me, sometimes we think about it in the sense of, in terms of race and ethnicity. And if we do not widen that all that diversity contributes, then that could be one of the reasons as to a team saying that we're not diverse. So it could be because of that. The other reason is, so you could have a diverse team and not know it. Not know it because you do not ask about all these diversity characteristics that we bring in. The other reason could be because you do ask the question, but the people responsible for answering the question are not doing so. There are reasons for that. It is not, some of us feel uncomfortable, unsafe answering some of the diversity characteristics because sometimes it's not known why it is being asked, and sometimes it has been used and have had a negative impact on those who share their identities. So it is very critical that when you ask the question about diversity, and for example, how diverse is my team, that is very clear in your approach as to why you're answering, as to why you're asking that question. The other reason could be the lack of equity and justice. And I want to take this cartoon to explain in just briefly as to what I mean by that. So if in your team you don't have equity and justice, that can be a reason for not having a diverse trial. So let's look at the quadrant number 1. It is inequality. So let's imagine that the tree is the system, or the tree could be the PI, and the little figures are people, are us. And you can see that if you think about the fruit as resources, that one individual is benefiting much more than the other. When we look at equality, which is quadrant number 2, this is when the PI says, I'm going to assign resources across all the members of my team equally. So you can see that the ladders are the resources. You still have a problem with some benefiting much more than the other. When we look at the quadrant number 3, which is equity, that is when the PI says, I'm going to look at my team members, identify their needs, and assign resources based on those needs. In this case, you have assigned the resources as the ladders. You see adjusting the height of the ladders, but you still have a problem because you have not fixed the system, which is the tree in this case. So when you have equity and justice, you need both in order to offer equal access on both resources and opportunities for people to succeed. So that could be a lack of equity and justice in the team can be a reason for not having diversity in your trial. The other one is belonging. Belonging is defined as that place that you feel safe, that you feel included, that you feel accepted just for who you are. And when that's not in place in a team or an institution, then it's unlikely that those people are going to, that you're going to have diversity in your trial. Now, let me move on to bias and stereotyping by the research team member. I am including bias and stereotyping because we all do it. We all have biases and we all stereotype. So let me just define bias for a minute. So bias has been defined as a predisposition to see events, people, or items in a positive, negative way, and it's also an attitude or a belief. And there are 2 types of biases. One is explicit. This is when you consciously and deliberate do something. It could be a positive, negative. An implicit bias is when it is unconscious and it's spontaneous, and at many times it's something that you don't mean to do. So those are the 2 types of biases. Now, stereotyping is normal. It's completely normal, and we all do it, as I said. So with stereotyping, it is a way to cope with a complex situation or environment. It satisfies our need to understand, and it also reflects cultural knowledge. And you see that I have in quotes, knowledge, because it is impossible for any individual to understand any specific culture in its entirety. And we cannot also forget about racism, other isms, homophobia, religious discrimination, and more. So if these types of behaviors are practiced in your team, then this can lead to not having a diversity in your trials. The other potential, this is more at the institutional level, is the cost for people to participate in your trials. So there are financial challenges, and there are also social determinants of health that need to be addressed and get on the way of people participating. You can imagine that when someone is worried about where's my next meal going to come from, or having a roof over their heads, participating in a clinical trial is not a top priority. And we know that with the pandemic, all these disparities have been made worse. So these are things that are more at the institutional societal level that need to be addressed. The other component that I want to mention is the political unrest and the attacks on DEIB that we are all witnessing, reading about it, seeing. So we have seen a decrease in the role in DEI roles that went from 33% at the end of 2022 compared to 21% for non-DEI roles. And if you have been listening to the news, you just heard about Walmart that has actually eliminated a lot of the DEI roles and resources as of recently. We have also seen in Florida, it started in Florida with blocking DEI programs at the state college level, and those we have seen also other states joining in. So it's not just Florida, this is expanding. We have also just gone through to a presidential election. It's not about who won, who lost. It's about some of the things that are being said. So less resources and less access for our LGBTQI plus community, or deportation for those who are illegal immigrants, including their families, even if they are legal in the country. So if you plan to engage those groups that I just mentioned in your clinical trials, it's very unlikely that they're going to feel safe, very unlikely that they're going to prioritize that, and very unlikely that they're going to participate. So this is why I'm mentioning all these potential barriers. So now, the lack of the DEIB in the research team, the bias and stereotyping, the cost to participants, the political unrest and the attacks on DEIB, they all contribute to these organizational barriers of the lack of effective community outreach and restrictive trial eligibility that Victoria mentioned. And let's not forget about the medical mistrust that exists in our communities, as well as the limited institutional policies focusing on recruiting diverse trial participants. So you can imagine that if we hear about all this negative connotation about DEI at the federal and local levels, that institutions are going to be less engaged in having policies that focus on recruitment of or people from more diverse backgrounds. So with this, I'm going to turn it over to Victoria to lead us into a brief discussion in terms of the benefits of DEI, of diversity in clinical trials.
Yep, thank you again, Dr. Genao. So now we know that diversity in clinical trials is a problem. We also know about some of the barriers to increasing diversity in clinical trials. So can I have maybe 2 or 3 people unmute and tell me what are some of the benefits of enhancing diversity and inclusion in clinical trials? What are some of the reasons why DEIB is important in clinical trial research? Not a trick question. Probably the first thing that comes to mind is what it is. Yep, go ahead, Lena.
Yeah, so medical conditions happen to anyone. There are just some medical conditions that are more frequent in specific specific genes, we know that, but most chronic conditions happen I'm a pediatrician, I'm a pediatric endocrinologist, so in children from different genotypic backgrounds. So then if a clinical trial is only completed in part of the reality, neither the medications that we're going to come out with, or the new technique that we're testing, or the behavioral intervention are going to be applicable for the whole reality. We're only testing something in part of the reality, and it's not surprised that many medications were not effective, neither efficient in the outcomes, because many clinical trials only include a portion of the reality.
Yep, that's beautiful. I think you just summarized my next slide. Awesome. Do you have anyone else? Thank you so much, Lena. No. All right. Well, we can go on to the next slide. That was perfect. So Lena, as you said, I mean, when we have clinical trial diversity, we have better science, we have better treatments, and then we also have improved patient trust. When we have increased diversity and inclusion in clinical trials, that can ultimately lead to improved recruitment and also retention as well. So this slide just kind of summarizes some of those benefits that were just discussed. I'll pass it back over to Dr. Genao for our next part of the presentation.
Thank you, Victoria. So it is very clear that we have a problem, and so now what we would like to do is I'm going to turn it over to Lee to take us over some of the potential institutional strategies to address this challenge.
All right, thank you. So now I'm going to talk about institutional level strategies that can be used to increase diversity and inclusion in clinical trials. Next slide, please. So research in the literature has explored institutional strategies and improving diversity in clinical trials. In the study by Genao et al., they have interviewed many leaders of institutions that conduct clinical trials. 4 categories of motivations for promoting diversity and inclusion in clinical trials are identified. The first category is ethical and moral imperative. It is widely acknowledged that clinical trials should include diverse populations to improve health outcomes of all people who may benefit from the medical treatment. The second category is leadership support. Commitment to diversity and inclusion from the leadership is vital to institutional level practices in diversity. The third motivation is funder requirement. Funding agencies such as the NIH and FDA have specific diversity-related policies and requirements that significantly promote diverse patient enrollment in clinical trials. Regarding institutional culture, many institutions consider inclusion and diversity part of the institution's missions and institutional core values. Next slide, please. So to implement diversity efforts in clinical trial enrollment, there are 5 key steps involved: staff investment, stakeholder training, resource allocation, community and patient initiatives, and infrastructure development. Next slide, please. As we're all aware, various deterrents exist that can negatively affect diversity efforts in clinical trials. The deterrents include cost and time, short-term impact, not easily or immediately measurable, and employees' familiarity with diversity and inclusion processes. Next slide, please. So to implement institutional-wide efforts in diversity and inclusion, the following 4 action plans are identified. First, commitment. Make diversity and inclusion an institutional priority. Second, partnership. We need strong multi-stakeholder collaborations to improve diversity. Third, accountability. We need to define responsibility for including diverse patient populations. Fourth, resources. We need to ensure the adequacy of resources in promoting diversity and inclusion in clinical trials. Thanks, and I'm now passing it on to Dr. Genao to address additional issues.
Thank you, Lee. So institutional commitment, it is essential. And without it, you can't go too far. But also, there's something that we also as the research team can do. And that's what I would like to go over with you. And some of this is common sense. This is not earth-shattering. So I want to just go over with you and let's think about this together. One is that the PI needs to establish psychological safety. And this is what I mean by that. The team members are expected, it is expected that they speak up, that they have a space where they can be honest and they can be authentic, going back to that sense of belonging that I mentioned before, where they feel supported by the team and the leader, where they can offer feedback and have discussions about different views, and that is considered totally normal, that they understand, or that there is a clear understanding in the team that everybody is learning, and that they're going to make mistakes, and that is okay, and that people can have conversations where they can agree to disagree. So psychological safety in the team is essential. In addition, it is important that they feel supported, and that there is no silent collusion. Silent collusion is basically going along through silence, which is the opposite of being an ally, where you speak up on behalf of someone else, and that is needed in the team. The other idea is about bias, increased bias awareness. I mentioned before that we all have biases, and many are implicit, they are unconscious. So one way to becoming more conscious of your own biases is by doing something like this, the implicit association test. The implicit association test comes out of Harvard and has been well studied and is totally free. If you were to Google IAT, it will come up. And what I encourage you to do is when you are assessing the different areas where you can have a bias, is that you choose one where you feel you have no biases at all, and one where you feel you have biases. And I assure you that you're going to be surprised as to what you find. And you can test basically your biases on many categories offered by the implicit association test. And I'm going to focus more on bias because it is something that gets on the way, and it gets on the way and we don't know about it. So there are additional resources. Penn State University College of Medicine offers resources such as the BERD training, which stands for Broadening Understanding and Inclusion Through Learning and Dialogue. That is available, and we have the QR codes here just to make it basically make it easier for you to access it. But it is available at the Penn State Learning Resource Network, where you can sign in and do the BERD training. Penn State Health also offers training, such as the Upstander Café, Inclusion Academy, and this QR code gets you to the calendar of upcoming events. So there are opportunities for you to become more aware of your own biases, and it doesn't take a lot of time. For example, the BERD training, they are broken down by 5 minutes, 7 minute session, so you can do it on a coffee break. Now, there are actions also that the team can take to attract more diversity in your studies. Let's just go over some of them. One is, as I mentioned, the diversity part. Develop a representative research team of the community that you are working with, or that you want to involve in your research study. The other one is provide appropriate compensation for those individuals who are participating in your study. Volunteering sometimes doesn't meet the needs of those individuals that you want to attract to your study. The other one is to eliminate the barriers. I think Terry was mentioning this before, in terms of that we we have a study, we have it at our academic center, and that's where the study happens. But you may have to bring the study over to the community or eliminate those barriers for them to access it. The other one is the research team cannot be a stranger to the community. By this, I mean, be part of the community by going to the community events, support the local businesses, participate in advocacy, be part of that community. And that's going to let you in than if you go as a stranger asking for them to participate. The other one is what I call ask more than tell. Sometimes we go into the community thinking that we know what they need. It's better that we ask for what they need and how we can help. So the Penn State Health conducts a community needs assessment, and those findings, there's a link here that you can access it. And that way it can inform you as to what the community needs are and plan accordingly for what your research can offer. Inform the community about available research projects that are either happening or coming up soon. The other one is share the research study results and the next steps. Sometimes we go into the community, conduct the research, and then we don't go back to them. They want to know what were the outcomes. There's more that you can do as a research team. So when you are interacting with the study participants, be conscious of your own biases. When you have a participant in front of you, what are some of the biases that come to mind? Be conscious of those. Also be aware of the participant attitudes to participate in the research project, as well as the reasons that they have for participating. That can include just a desire to contribute to science. It could also be related to a personal family experience with a particular disease, or it could be financial incentives. And we want to make sure that we don't take advantage of that potential need that someone may have. Trust, somebody mentioned trust earlier. Trust is so important, not only to attract the participants, but also to retain them in your study. And then the last one that I want to mention is to make sure that you share your knowledge, the interest, your enthusiasm for the research study that you are recruiting participants to participate in. With this, I'm going to turn it over to Lee so that she can take us through some of the resources that we have available for you.
Thank you. So there are many resources at Penn State if you have questions or need help regarding diversity and inclusion in clinical trials. Next slide, please. So within our Hershey campus, we have the Office of DEB and the DEB champions at the College of Medicine, and the Office for DEI and the vice chairs for DEI at Penn State Health. Other resources include the Office of Equal Opportunity and Access, the Office of the Vice Provost for Educational Equity, and at University Park, and the Penn State World Campus Diversity Studies Certificate Program. Community leaders, organizations, and individuals are also great resources to go to. Next slide, please. At Penn State, there are many social justice researchers who have initiated various impactful programs. The DC Social Justice Initiative, led by Morimon and Patterson, is a fellowship program in which Penn State students develop a social justice curriculum to teach high school students at Washington, D.C. Other programs include the Social Justice Collaborative, led by Dr. Stringer at Penn State Berks, the Center for Social Change and Belonging at University Park under the leadership of Marcellus Braxton. At the Center, Philadelphia, and the Arlington campuses, there are active social justice researchers. Next slide, please. So here's a list of recommended reading that can be very helpful in promoting diversity and inclusion. The book, How to Become an Anti-Racist is written by the American author and historian Ibram Kendi. So you want to talk about race? A bestseller by Ula offers a great advice on how to talk about race. Next slide, please. Blind Spot, Hidden Biases of Good People is a book by two leading psychologists exploring hidden biases. Small Great Things by Jodi Picoult is an intriguing novel that offers a thought-provoking examination of racism through the story of a nurse. In the book, Dear White America, Letter to New Minority, Tam Weiss has analyzed the problem of racial injustice. In the book, Reinventing Diversity, the authors have examined how to make workplace diversity programs successful. Thanks. I'll pass it on to Dr. Genao.
Thank you, Lee. So the key with these resources is, the key message is, you are not alone. We are here to help you. We're here to help you both at the health system, at the College of Medicine, and at the university. So like Victoria, for example, she is connected with some of those researchers that Lee just mentioned. So you are not alone. Just reach out for help. And we also have, I want to mention this workshop that is coming up on December the 18th. The QR code is here, also to just make it more convenient for you to sign up. But it is a collaboration between the CTSI and New Mexico. And I'm also collaborating with this group. And the idea is that you attend, and I think that this is so very much in alignment with what we are talking about, because two of those reasons why I attend are very much in alignment. Connect with others who are interested in engaging patients and communities in research, and the other one is create strategies to support and advocate for patients and community in research, which aligns with recruiting a more diversity in your trials. And I want to leave you with the list of references that are some of what we used to build this information that we're bringing to you, but also resources for you to continue reading. And I want to make sure that we have enough time here to have a time for our Q&A, and I'm going to stop sharing and just now have more of a conversation. Yes, Terry.
Nice presentation. Thank you very much. A lot of great stuff there. I'm a biostatistician, and so when I think of how do you make clinical trials more representative, I go right to the nuts and bolts. And I wanted to bring up two good examples. One, LJ Van Scoy has an R01 now, where it is aimed at the promotion of advanced care planning for critically ill folks, specifically among minorities. And she's done a really great job with that. So that's one really good example we can look up to here at the Penn State College of Medicine. Some administrative databases, one I work with is called NHATS, the National Health and Aging Trends Study. They oversampled African Americans and folks 90 and above, both of whom are traditionally underrepresented. And that study is doing a great job helping us really understand issues among older African Americans and much older people in general. So I just wanted to throw that out there that, you know, it's intimidating when you think of how do I change the whole research infrastructure to be more inclusive. But there are people successfully doing it both within here, the Hershey College of Medicine, as well as on the national stage. So there are lots of people working with you. Don't give up. We have to continue plugging away at this. even if the political situation is not particularly supportive.
Thank you. Definitely don't give up. That's for sure. And form those connections, because that's what's going to make us stronger. And just figure out why this other team has such a diverse clinical trial. So let's find out what it is that they did. Any other questions or comments?
I'll just add, you know, when folks are designing a clinical trial, they usually randomize some kind of treatment, but you can also stratify the recruitment to specifically make sure you're covering your bases with characteristics such as race and ethnicity, or even low income that have been ignored. So the tools exist. This is all entirely doable. It's about finding the will.
Thank you.
I have a question about returning results to participants. Could you provide some examples of how to do that effectively? The reason I ask this is I just finished this study, a cross-sectional survey study, and we had some interesting findings, and we've published everything. But I know participants had mentioned to us that they would love to hear what we found out when they enrolled in the study. And so I was just curious about how you've done that and what we could do.
Sure, and Victoria and Lee, please add. So I would say, Tolika, one idea is to connect with a community leader who you can say, I have these results that I'd like to share back with the community. What are some of the best ways to do that? It could be a town hall. It could be going to one of the churches and say, you know, I want to share this information at the end of a service. Or it could be that that there is a newspaper or a newsletter that is part of the community that you can share the results. But it could be sometimes word of mouth. So there are many, I would say many ways, but I would say that probably the most effective way will be to connect with the community leaders, community organizations that can help you to disseminate the information.
Yeah, absolutely. And then just to add on to that, we know that community members aren't necessarily going to look at your findings in whatever journal that you publish. So it might be helpful to also maybe create a sort of brief, or maybe a toolkit or something like that, just to make the findings a little bit more easier to digest for community members. And I don't know how you recruited your participants, but if you potentially partnered with different organizations, and you could use those same organizations to maybe publish whatever brief or whatever publication that's easier for community members, that might be helpful too.
Anyone else? All these researchers, biostat.
In my study, we did it was a case control study last 2023, 2024. What we did is we offered the families to send them the results, because it was dietary online assessment, and we also collected omega-3 index. And part of the information given at the time of enrollment was that we will send the results to all the participants by email. And we did that. There were some questions coming after that that we were not prepared not to answer. I mean, we knew the results and the interpretation, but we asked them to continue the conversation about this dietary analysis with their primary dietitians, because these were kids with type 1 diabetes. So they all have a dietitian as part of their routine care. And that was something that we decided to do from the beginning. So there was a very good reception, and we're having that is helping us, I think, to also have good rapport with the families, and it's more than we expected. Really, like it helped us to move into that direction of promising that we will get back to them. They will know the results.
Mm-hmm. Well, it's a great idea to establish that connection from the beginning and then wait for them to receive it. So they are expecting that email from you. Thank
Right.
you.
There's like, maybe I can add something, like there's a national examination, enhanced, it's a national health and nutrition examination survey. They collect patient data and conduct patient physical examination, and they send back the results through a secure patient portal where the patient can access the information with a password, and also patients can select to share the results with their providers or not. And the information that's shared usually includes like actionable information, like if they found out that they have hypertension, then they want to know and their providers want to know.
Mm-hmm. And it can benefit all the patient and the investigators.
I just wanted to give you folks some kudos for using the poll feature. I don't think we've seen that in any of our other seminars this whole semester, so that was good. And I like that you encouraged us to turn on our cameras. It makes it, you know, a little less techy.
Yes, yes. More human, more human. Okay, Lynn, so it's about 7 minutes to the hour. If no more comments, do we give 7 minutes back?
Yeah, that would be nice. Any question from audience? One more chance. Okay. All right, thank you very much for your time presenting here. Really appreciate your talk. This really gives us more like an overview about how to promote diversity and inclusion in clinical trials. I believe many investigators will be looking forward to working with you in the future when they design a new study. Okay. So thank you everybody for joining us. This is the last seminar for this semester. Our spring seminar series will resume in late January. Please stay tuned for the announcement for the spring seminars. Thank you.
Thank you.